welcome back to Dr. Noah's Protandim updates, and we're going to talk a little bit about teeth. Big problem. There's been lots of research now that your teeth, beyond just looking at your teeth and pain and all like that, has a big systemic type of problem. The bacteria that's in your mouth, if you have gingivitis and periodontal disease, those bugs can actually increase your chances of heart attacks. And so this kind of goes along with functional medicine, holistic medicine, and there's holistic dentists out there that understand that your teeth is a microcosm of the rest of it. So, antioxidants are a big factor in terms of that, not only in terms of preventing cancer and heart attacks and strokes and diabetes that we talked about, but also in periodontal disease, which is a big problem as about age 30 or more. Periodontal disease is the number one cause of losing your teeth. And just kind of show you some of the research that's out there. Conclusion: the results of present work showed an important correlation between oxidative stress biomarkers and periodontal disease. Very well established. This was published in Mediators of Inflammation, volume 2007. So if you're able to reduce antioxidants, as we know with Protandim being a nerve-2 activator, is able within just 30 days to be able to reduce the oxidative stress to a baby, that's going to have a major consequence on your teeth. Another study here in Journal of Industrial Microbiology and Biotechnology, 2007, oxidative stress and acid-base physiology of dental plaque biofilms. Another type of problem that dentists and holistic doctors is the bugs produce these biofilms. It's kind of like their little magic force field, and those are difficult to break down, except that using natural type of ways we're able to do that. And so overall, agents affect oxidative metabolism, possibilities reducing pathogenic activities of plaque. So by reducing oxidative stress, it allows the body to be able to use other type of natural type of forces to be able to go into that. And oxidative stress in periodontal disease, a critical link in cardiovascular disease. That's what we were talking about before. This was published from India, published in Biomedical Research 2011, showing that periodontal disease is one of the most common oral infections induced by bacterial and bacterial products of dental plaque, and characterized by inflammation, destruction of tooth, supporting connective tissue, and a alveolar type of bone. So that's the number one reason for bone loss. But it goes on in saying that that periodontal disease is a risk factor for heart disease, and the conclusion is the increased oxidative stress, altered lipid profiles in periodontal patients could contribute towards cardiovascular disease in these patients. So by reducing that as well as being healthy, you're able to reduce. A newly identified role for superoxide in inflammatory pain. This was published in Journal of Pharmacology and Experimental Therapeutics, 4 different types of problems with teeth, and showing that superoxide dismutase, which is what Dr. McCord discovered back in the late 60s, that's able to be increased substantially over in terms of taking Protandim. I got too many P's here. And the last one is oxidative stress in periodontal pockets. So oxidative stress is a big factor. So when you talk to your dentist, you definitely have to talk to him or her as a real health professional, as a doctor, being kept up to date with the latest type of technology in terms of helping prevent bad teeth, but overall health and well-being, and that's through Protandim. Thanks.